On March 6th, there were only about 100,000 cases worldwide and only 121 reported in the United States.
I actually went back in my journal and I found an interesting excerpt. I wrote that there's no time to sit and write what I need to. I wrote, today the pandemic is absolutely global. New York City, Michigan, California, and Seattle are absolutely overrun with cases. There is no PPE. We are reusing everything and coming up with ways to sterilize our masks. Sorry. Sanitizer and toilet paper are valuable commodities. Today I had to write a letter to all of our residents and faculty to reuse their masks until they could no longer be reused. And New York City is using big trucks to clear away bodies. So I think early March, that's where my mind was.
Very early in this whole process, we were very concerned that this was going to have the potential to be the world's next pandemic. I don't think any of us would have guessed how big it would have gotten before it was over, but we knew that was a possibility.
When things started first turning up, I remember seeing the news, about COVID and happening in China, and then they built a 1,000-bed hospital in like a week, and it's like, I even mentioned to my supervisor, look, we might want to order some extra masks. This just looks potentially serious. But then, at that time, things felt like they were kind of brushed off a little bit. Looking through the year, it's just one of the biggest fears is bringing anything home to your family.
The first report on COVID-19 in cases in the United States in children didn't come out until April. And at that time, we had testing struggles. I mean, we had testing struggles from the beginning of the pandemic. And at the time, the report said that of the 150,000 cases in the United States, 1.7% of them were children. So only 2,500 children at that time had tested positive. And so so compared to today, that number is so different. So today in Oklahoma, we've had over 55,000 Oklahoman children contract this virus and test positive for it. That represents 13% of the total cases.
So we're in June now, and while we had a lot left to learn about COVID, we did know quite a bit. And we knew that it spread primarily through droplet, and that droplets spread primarily through close contact when people are unmasked indoors. And so when we hear that there was a gathering being planned in our city where there were going to be 10,000 or more likely unmasked people in close contact, we were terribly concerned.
The past probably 2 or 3 weeks, it's eased up immensely, but gosh, just right after Thanksgiving, that's when it really, the magnitude was just unreal.
One of the things that I learned took a little while, but that the mitigation strategies, those things that we could do to prevent the spread of this virus, wearing masks, physical distancing, washing your hands, were incredibly important, much more so than maybe I thought right early at the start of the pandemic.
Just the past couple of weeks, our past 2 weeks specifically, our ventilator numbers have decreased, and it just feels a lot easier. The morale is even higher. You can just feel it around.